Compile, perfect, yeah. Sure.
Great, and so any panel speaker should be.
Which ones are we doing? Both of these decks?
Which, where are you?
Oh,
Is it
thank you.
stuff that Mary brought you?
Yeah, these two speakers here.
Oh, okay. Hi, good morning.
Well, let me get this file.
Oh, it's the one inside the room. Yeah.
You go in some folder. And where do we want that placed? Yes. Yes. Yes.
Yes. Okay, and then we. Thank you.
These are Mary's slides, and if I understand it, that you place them in the board and this.
Yes.
And Eva doesn't have any.
No.
Just double check.
So we're there, and this is the new deck. And it's before 10, yeah.
It is good. Can I just speak to them? All right. Yeah.
And where are you?
I'm starting from. No, keep scrolling. Keep scrolling. Yeah, from here.
There?
Yeah.
Okay,
Is this
so
next
slide
one?
14.
15. Let's see.
So this one, I was saying, if it's okay with you, nice to see you, by the way. No worries. I was saying, if it's okay with you, I'll introduce speakers and then they'll come up to the podium to speak, and when they're finished, they can sit
Yes.
along there.
Yeah, so we just.
Alright.
Very well, thanks.
Yeah, well, you, yes,
have a
you
name
do
tag
that.
yet.
when
Oh,
you're
it's
doing
okay.
a series.
It's,
I'll let
literally-
you come up, you
That's
do your
right.
presentation.
Do you-
Just arrived.
Other
Leave your name?
speakers will-
Well, I don't know.
You should be the first,
Yeah.
because Henry
You know,
can
get it
speak.
out.
in
Okay.
Dutch.
But we just had a meeting. Hey, how are you? Nice to see you.
Good, nice to meet you.
Hi, I'm Bruce. I haven't got my name tag yet, so.
Okay.
Yeah, no, my gosh. Well, just because we had our JMP and Glass SAG meeting that ended like 1 second ago, and then New York came in late last night. And
Nice to put a face to the name.
yeah, it's really nice to meet you too.
too.
No, I'm excited about this session. It's gonna be fun.
Yeah.
How's the UNC been so far?
Good, yeah.
Yeah.
Ticking along. We're just getting everything set up.
Okay.
It's all about just figuring out.
You're moderating and introducing people.
Yeah, so I would introduce you.
Just spotlight.
Okay.
You just make it up.
I don't want to do that.
You can say anything you want.
Hi, Bruce. Yes, hi, well, hell yeah, organization. Hello, good afternoon.
So nice to meet you. Sorry, let me just.
We're trying to figure out where.
Nice to meet you. Have we met before?
Yeah, I was in WHO working with Mahmoud.
Oh, Mahmood, okay.
Let me just-
Oh, wonderful.
doesn't matter.
How's Mahmood doing?
Yes,
these
do
days?
Yeah.
Because we don't
yes.
need it until she speaks, I think, right?
Oh, just, okay, so.
It's this inspiring vision sometimes in the
Like that.
future, right? When the work gets really.
Okay, so what we'll do for that
So,
is we will spotlight her in the back end, and we'll just have
I
to
did.
drag her over, basically like
we were
this.
talking with
On-
uh,
like I will on this computer?
Yes.
Okay.
Yeah, Rick.
And
Yeah,
that's just, and I can
okay,
keep the box right here, it'll
Rick's
always be
thinking all
shown.
week.
Okay.
so, Yeah.
If you want to look right here and
Yeah.
Just to,
Just
see you again.
grab this.
Oh, so we
Had
can see
several
it on
job
the-
during
Yeah.
class.
on the-
when I was in
And
WHO.
first, we're
But now
Useful.
I didn't do it. and,
Can I get the-
moderating it. Yeah, sign it.
Nice to meet you.
First, we've got
Yeah,
just doing.
people.
introduction.
Okay.
Like it's foundation.
Nice.
I'll introduce.
Well, I look forward to talking with you. It's gonna be, and it's great that you're with you. So are you focusing on sanitation? Okay, perfect.
What primary target.
Oh.
Today we are for the presentation.
It's kind of big.
Hi, Lana. It's good to see you. I didn't know anything.
Yeah, that was how you lost. All right, great.
Yeah, okay.
And I'm sort of like,
To
I got
say when,
like, you are quite.
Yeah, we have. Under here soon. All
All
right, now check.
How are you?
But I just wanted to say hi.
My second time.
Good.
Since we just-
Yeah. Well, it's nice to see you like not in a
I know.
conventional plane, you know what I mean?
You get to see how tall everyone is, right?
I know. That is a, yeah, and sometimes it matches expectations and sometimes it doesn't.
Definitely.
Does it, so do I or no?
Remember.
Just like, do I, am I looking at?
Yeah. But it's always, people are always called that, so that.
Oh, really?
It's mostly because my neck hurts. They were.
We can, yeah, in 2 dimensions, we'll do the same thing.
From the audience, sorry.
See you.
Yeah.
Today you have the presentation on sanitation risk worker. that is
Okay.
receiving the best respect award in the category. And he is presenting our central direction.
Yes, and they're.
Okay, I see you on
Either I.
agenda.
The Q and A or someone else can moderate it, but it is an option. So we.
Oh, but I-
Okay, yeah, so it'll just be right here. So just to be sure. It's a slide.
So you get to accept this award in.
Yeah. So you've got Slide.
I saw that's something.
On the right, it's slide reaction. And then we have the Q and A.
Not that important. Thank you, mother and father.
Yes.
Haven't had any sense in my conference, but I
Okay.
Then you
typically.
These questions are more-
Yeah.
But top 25 people, but they said rather this year is special, I mean, more people, especially people are retaining in the sessions. People in such conferences, almost the end days, you don't see people in the sessions.
Well, I mean, I guess this one is hybrid, so we'll get hopefully people online and they probably are wondering what we're doing right now. When you're sitting at home in front of your computer, and, what's going on? But then in person. So should we kind of get going if people are on this? Is this theoretically supposed to start at 8:30, right? And I do think that there's, I don't know what people, but I'm happy to.
We have to propose.
So, and do you know, just before, this is immediately working online?
Yeah, so it's streaming.
Okay, we're live now.
You're live.
Okay, well, so apologies to anyone online that is just waiting for this to start, but let me just welcome and introduce everyone in the room and of course, a lot of people online. This is an exciting session for me because I have to say, well, first I'll introduce myself. So my name is Bruce Gordon, and I'm the unit head of water sanitation, hygiene and health at the World Health Organization. And the reason I'm excited about this session is I just came from the New York preparatory meetings for the 2023 water conference that will happen in March. And what happened in those meetings, I'll talk about it a bit later in the conference, but there was just a tremendous amount of discussion and input and excitement from virtually all member states. And there was a lot of excitement about health and about human rights. And so if I'm thinking about anything that aligns and is relevant to a human rights perspective on WASH and sanitation, it is particularly this issue of protecting the health and dignity of sanitation workers. So I think we're in the right place. And what I also wanted to say was that there is a tremendous amount of knowledge gaps on this. I mean, there is obviously anecdotal evidence that this is, you know, harmful to health, and sanitation workers need to be protected, particularly health issues like gastroenteritis, you can imagine, respiratory infections, social and mental dignity issues. But at the end of the day, when we've looked at this, and there has been some systematic reviews, or one anyway, there's a lot more to be done. And I think when one makes the arguments, you know, for policy change, it does need to be backed up, you know, by science and evidence. So all the work that is being done in the research field is just tremendously important, and that's kind of why we're here. We have a whole session today that will kind of focus and centered around a research agenda. So a series of research questions that are prioritized in a very systematic way from the perspective of experts and the perspective of sanitation workers themselves. So actually, I probably should go to the next slide because I just forgot where I was. And I see there's 83 of them, so I better hurry up. Don't worry, I'm not doing all 83. Can someone advance the slides? I'm not sure if I pressed the button. No, yeah, I just wanted, yeah, perfect. I was going the wrong way. So just a few quick points before going to the agenda. This is an issue that is brought up in the WHO sanitation and health guidelines. I mentioned the review, and I mentioned the fact that there's knowledge gaps. And just to say that this process and this session that we're talking about was done in a very participative way. And we really reached out to the science, research, and user communities. I will just show you the agenda now before passing to my colleague, Joanne Estevez-Mills. So I've given a little bit of an introduction and hopefully put us over time. But we're going to hear a series of presentations from WaterAid, and may I say that this is a joint initiative on sanitation workers that has been in partnership with UNC, but has been kind of being promoted over years with WaterAid, the World Bank, SNB, and I'm missing someone here. I apologize. I'll get to it in a moment. I know there's someone I've missed, but anyway, and ILO, sorry. So the International Labor Organization, of course. So we'll hear a series of presentations, and Joe will walk you through that. And then we're really excited because some of the presenters are, you know, kind of foremost in their field, and will be presenting new insights that I hope will energize the community in their research. So I'm going to pass over to my colleague Joe now to guide us through the session.
Thanks, Bruce. Thanks all. I see people joining, which is fantastic. We're just getting started. So we do have a series of presentations, like Bruce said, and an opportunity at the end as well for Q&A and for discussion. The first presentation we have today is virtual. So we are really privileged to have Kanika Singh from WaterAid join us remotely. And if the technology doesn't fail us, it should work very smoothly. So Kanika is a sanitation advocacy professional and works with WaterAid as a project manager of the initiative for sanitation workers. Perhaps we'll just wait till she's on the screen. Kanika, can you hear us?
Yeah.
Oh, brilliant. You're not. Hi, Kanika. So Kanika is going to share about various efforts being undertaken by the collaborative initiative in order to bridge knowledge gaps and generate more evidence on sanitation workers' rights. And Kanika, I'll progress your slides. So if you just let me know when to move them along. Over to you. I say that.
Sure. Thanks, Joe. Hello, everyone. I'm Kanika Singh, and I'll speak about some initiatives being undertaken at the global level to strengthen research and learning on sanitation workers' rights. Next, please. So I'm representing the Initiative for Sanitation Workers, which, as Bruce mentioned earlier, it is a collaborative global advocacy initiative between the ILO, WaterAid, World Bank, WHO, and SNB. And one of the objectives of the initiative is to support research initiatives which can help address the knowledge gaps, which in turn can help improve the situation of sanitation workers. And in today's presentation, I'll be sharing briefly about various activities we are implementing on this front. Next, please. The first activity involves research support for 25 studies, which includes studies undertaken by 13 institutions and 12 PhD and master students from low and middle income countries. So the support to them includes financial support as well as support to publish their papers in open access journals. And for students, we are also offering, in addition, opportunities for mentorship support, peer-to-peer learning, and learning workshops with thematic experts. So these studies cover different themes related to mostly health and safety. And also there are a few studies which are around issues of dignity, alternative livelihoods, and policies and guidelines to support sanitation workers. And there is also diversity in terms of the geographical coverage. So we have studies from 11 countries in different parts of Asia and Africa. Next, please. Another way we are trying to encourage research is through the Sanitation Workers Research Awards. So these awards are a collaboration with the Water Institute at University of North Carolina, where every year we award the best abstracts and the best published papers on sanitation workers' rights, which are submitted for the UNC Water and Health Conference. And the winners are announced during the conference. So today we have the announcement of the second edition of the awards during the plenary session, which will follow just after this side event. So do join us for the announcement. This would also be live streamed in case you are participating virtually. Next, please. We also have an initiative led by the WHO to identify the global research priorities around sanitation workers' rights. But I will not go into more details as my colleague Bisola would be presenting this in a few minutes. Next, please. We are also undertaking some studies under the project. And one of this is led by the World Bank and SNB. So this involves the mapping and review of different existing instruments to support the health, safety, and dignity of sanitation workers. So these instruments include procedures, guidelines, and regulations, which are already under implementation in low and middle income countries. So this study is about to be completed now, and it is helping us identify the key aspects which should be included in different types of instruments. And based on these, we are working on developing some cross-cutting guidelines for the design of these instruments. Once this is completed, this will pave the way for preparation of detailed guidance notes and templates, which can be then adapted and used by different stakeholders such as governments, practitioners, and development partners. Next, please. The second study, which is led by World Bank, aims to review the existing experience around the use of technologies to support sanitation workers' rights to health and dignity, and also gaps which exist in innovations around mechanization in the processes of emptying of pits and septic tanks, sewer maintenance, and safe treatment of fecal sludge. So based on this study, priority areas for innovation and development are being identified, and we will soon release the findings of the study. Next, please. Last but not the least, while in the last few years, some work to generate evidence on sanitation workers' rights has taken off. We also felt that there is a need for some way to share and exchange the resources and knowledge outputs being generated. So with this idea in mind, we developed an online sanitation workers knowledge and learning hub. So this is a platform for exchange of resources on sanitation workers. And this is hosted on the Susanna website. Next, please. So the platform, among various features, it features a resource library. So this is a screenshot of the repository, and people can use the filter or the search function to look for relevant documents on different themes. And anyone can upload their documents on the platform. So the guidance for uploading and accessing the resource library is mentioned in the FAQ section on the website in case you would like to check out. And since this platform was launched just 2 months back, we have only just started uploading content on the platform, but we would love to have some more contributions from different organizations across the world working on this issue. Next, please. We also have a blog on this platform where people can upload and contribute their articles and blog posts. And again, the process on how you can contribute your blog is explained under the FAQ section. And we also invite feedback to make this platform more effective and user-friendly for different actors. So in case you have any questions or suggestions for improvement in this platform, feel free to write to us. Next, please. So yeah, that's my email. Thank you so much for listening, and over to you, Joe.
Great, thank you, Kanika. And if it's okay with everyone, I think we'll get through a couple more presentations before we turn to the floor for questions. But I'd encourage you to have a look at the Learning Hub because it really is a brilliant platform. Okay, so for our next speaker, I'm pleased to welcome Abizola Osinuga, who is a research consultant for the WHO on the Global Research Agenda for Sanitation Workers Project. And she's Research Program Manager at the Center for Health for Equity Research at Chapel Hill. And she specializes in designing and implementing gender transformative WASH, occupational health research studies and intervention programs. And she'll talk about the development of the Global Research Agenda for Sanitation Workers. Welcome, Bizola.
Thank you. Hello, everyone. I know it's pretty heavy in the morning, so I know you're just getting to wake up and all of that. I hope we've all had our coffees and our teas and we feel refreshed. So I just want to talk about our process for developing the Global Research Agenda for Sanitation Workers and how what methods did we use, how did we engage our stakeholders, how did we collect this information and all of that. So as you know, like a global research agenda or research priority is the process of convening different experts or practitioners to sort of deliberate on what next, what is the research investments efforts we need to focus on perhaps over the next 10 to 20 years. And we try to conceptualize this process for our work, which is in making sure that we develop or we sort of lay out the next steps to follow in terms of research priorities for sanitation workers. Some of this information are already in the literature and they've been talked about by different bodies, and we decided to collate all of that into like a central location and make sure that it's done systematically. So why do we want to do that? Engage decision makers and stakeholders in generating and developing research priorities for sanitation workers at global and national level. And this is to ensure that we are allocating research investments to solve critical challenges and improve the health and working conditions of sanitation workers. Also raise awareness on the health risks faced by sanitation workers and hazardous working conditions of the work. Another thing that was really critical for us is that we wanted to ensure that the voice of sanitation workers, unions and organizations were represented in the process. I'll walk you through the steps by which we did that. So, as I said before, some of these things were already atomized in the literature. So, for example, the joint report by the Initiative for Sanitation Workers in 2019 talked about different occupational and health and safety issues facing sanitation workers, weak legal protection, financial security, and social stigma of the work. And then also the systematic review on also really talked about the different types of health risks and hazards sanitation workers face. And then we also conducted a rapid review of the literature and went through each of the future gaps, future implications and recommendation sections. I sort of collated and grouped all we found across the literature, the knowledge gaps that are identified across the literature, across 33 articles. And as you can see here, many, the most knowledge gap, the most frequent knowledge gap is technological innovation, as well as occupational health and safety. But other things such as quantification of the workforce and also generating sustainable livelihoods for sanitation workers was important, as well as policy, regulatory and legal protections, improving policy, regulatory and legal protection for sanitation workers. And then behavior change interventions to improve the use of PPEs, amongst others. So our method is first that we did that content analysis of the 34 studies that I just talked about. And then we assembled an advisory group of 15 diverse sanitation experts across the global sphere. And then the members helped us in defining the scope, refining the themes, and the methods we wanted to select in this process. So when we looked through different global research priorities methodology, we decided that the Child Health and Nutrition Research Initiative method would be best because it's very metric-based. We can really score each of these priorities and rank them against some criteria that I'm going to talk about. So we could also sort of group the, as we are asking people to elicit questions, we could sort of prompt them to think about how useful those questions would be and what are the areas they need to solve. So some of these criteria is already published and used across over 165 research priority studies across the globe. So it made sense to just use this method that have been used widely. But one thing we did is that because it's so health focused, we had to tailor it to the context of the work we are doing and make it more generalizable and fit into other contexts like social and behavioral issues rather than just health problems. And then another thing we did was that we modified the criteria so that when sanitation workers themselves are sort of ranking the tools, they're able to understand it better and moving a bit from that very stringent research kind of methods. So the next thing we also did is that we collated, after we've done all of this process of making sure that our methodology is sound, we collected ideas from 76 respondents through surveys. I'm sure some of you probably found those surveys and you filled it out for us. And we also collected ideas from panel discussions at the last UNC conference and the Sanitation Workers Forum last December. And then we deduplicated those items, the 79 ideas or questions collected into 55 and grouped them based on the themes that we had already identified in the literature. And then we pilot tested this survey again at the conference session. And then we further simplified because we know that at the end of the day, we had like 55 questions in total, but they were still a bit hard, I won't say, they were not as intuitive for other people to understand if they are not like research practitioners. So we worked with sanitation workers, professionals across the globe in certain countries like India, Kenya, Nigeria, to make sure that the language you are using is appropriate and is easy to understand. And then we also try to collect information through different ways because we know electronic survey will not be available, will not be appropriate to target some hard-to-reach workers. So we sort of did focus groups, interviews, paper administered survey as much as we can to ensure we have the voices of sanitation workers and union leaders represented in the process. And then we analyzed and ranked the questions based on the degree to which it's answerable, translatable, effective, equitable, and has potential for impact and is sustainable. But we reduced that criteria for the sanitation workers and selected only 3. And then we calculated agreement score across each of the questions. So here is the definition of our scoring criteria. Answerable is the degree to which it's practical and we can implement this question. Translatable, potential for scale up across the diverse groups and contexts. Effective is that it actually minimizes health risk and it informs policy or infrastructural development. Equitable is that it's very, very available for the most marginalized and relevant to them. Potential for impact is that it markedly reduce health risk and improve working or living condition. Sustainable is it leads to generating long-term solutions. And then the last 3 that you see down there are majorly the criteria we only use for the workers because we wanted it to be simple and we wanted them to be able to complete the surveys because the questions were a bit much. So we just used importance, which is kind of still similar to potential for impact. Feasible is similar to answerable, and then applicable is very similar to translatable. So they are basically almost the same. We just sort of tweak the words. And then for the CHNRI domains, according to the CHNRI framework, you can group priorities based on how they describe a problem. And the problem that has been really said in the literature is about health risk and conscription of the sanitation workers. So we group those questions under that. And then delivery is the questions to assess or evaluate the implementation approaches or the use of existing policies and interventions. And then development include questions to improve the quality, affordability, and accessibility of interventions. And then discovery is questions that lead to innovations or generate new knowledge. So here's the characteristics of the respondents. The first survey that was sent was to sort of collate ideas from different sanitation experts. And this was majorly to those that are practicing in the field. As you can see, if you look at the organization of those people, we have people from the academia, from NGOs, from private consultants. And then the second survey from experts rank. The first survey is that we are eliciting ideas, and the second survey is that they are ranking the ideas. As you can see, even though we had more people, experts that are practicing in Africa and South Asia compared to Europe. And then for the survey itself, we had lots of sanitation workers from Africa and South Asia, mostly represented here. And as you know, since this is a very, very male-dominated field, we had more men that are sanitation workers or representatives of sanitation workers union compared to female. But for the experts, it's almost similar. And so here is the total respondents for the survey where we collated responses. As I said before, we had 76 people that sort of gave ideas. And then for the survey from experts, we had 38 experts rank the survey. For the survey for workers, we had 58 workers rank the questions. And then we have, as you can see, we have a diverse group of countries represented here, like 21 countries or 20 countries, an average of that, which is quite a bit, trying to make it more representative and really tie into what we see at the global and national levels. So please turn to the papers on your table because this is a bit much and it's not clear. I just want to run through the patterns of questions we see from experts. As you can see, we have questions that are much more focused on delivery, how interventions are delivered, and they focus on like legalizing and improving social protection for workers. And under the development section, we have questions that focus on technological innovations, improving the design of PPEs and the use of PPEs, and also making sure that like their behavior change intervention is implemented for sanitation users to improve the management and safety of sanitation systems. This is just, we have over 39 research priorities in total, but we just selected 10 of that. So we still have other questions relating to gender issues in sanitation workforce, other policy implementation issues that are not covered here. And then the top 10 research priority questions for sanitation workers. As you can see, if you compare this is very, very kind of homogeneous, right? Under delivery, you see like they follow the same trend, but for sanitation workers, it's more varied and span different type of research areas. For sanitation workers, it's really, really important that there's much more there's the health and safety of sanitation workers should be focused on, and like another for the delivery part, it's all focused on like trying to make sure that marginalized workers are better represented and involved in decision making. And then for the development, you can see that sanitation worker and unions are also interested in building capacity and providing social support structures for workers. And then for discovery, it's focused on improving local supply chains and markets to strengthen and sustain technologies and infrastructure, as well as ensuring that PPEs are better designed and appropriate for different workers in different contexts. There are similarities between the two, but it's just to say that for the workers, they want research priorities more targeted at improving the safety and dignity of the work, especially for marginalized workers. So ideas varies widely in scope and covered most of the knowledge gaps identified in the literature, such as examining the legal and social protection of workers, including sanitation workers in research and implementation decision, and also identifying technologies that are more widely applicable and scalable, as well as understanding the root cause of marginalization to better address them. And we have 1 or 2 questions on examining the gender aspect of work. So the limitations, there are some limitations in this process, such as we tried to ensure that we had adequate representation across and within different stakeholder groups, but we didn't have enough representation from those that are like local or governmental parastatals across the countries. And then the survey is a bit complex because there were lots of ideas. There were like 75 ideas. We tried to reduce it to 55, but it's still a lot. So telling people to rank those ideas against 3 different criteria could be time consuming. And so we try to find we try to use different procedures to ensure they get to complete the surveys, but it's still complex and that could have affected our response rate. And then we also try to simplify the survey for sanitation workers to ensure that they're represented in the process, but it could have impacted on comparability and us being able to like compare the estimates. So in conclusion, sanitation research and practice till now has paid relatively little attention to workers. Like this process shows that workers are really interested in having a seat at the table and be part of research. They understand what is important to them and they can tell their story. So we need to do a better job of doing that. And then we also need additional work is needed to refine and contextualize research agenda for different contexts in different studies. And then research questions should be applied to a diverse range of communities, people and geography, high, middle or low income countries, and for workers along the chain. And then research should routinely involve workers in all aspects and avoid reinforcing conditions that contribute to stigma and marginalization. And then successful research would help us really improve the quality of the work done in the field and the size of the community of practice, which Kanika had already talked about, different measures that are being done to ensure that there's increased visibility and dissemination of the kind of research coming from this field. So here is our next step. The research agenda will be published and made available on the WHO website in time for the World Toilet Day. And then future work by WHO will include working with ILO and the JMP to quantify the sanitation workforce in order to meet the SDG goal 6.2. And then we also will celebrate a World Toilet Day and countdown for 2030 for sanitation. So thank you so much for all being a part of this process, even completing the survey and doing all of that. Really appreciate you, and please discover more at this website and log into the Sanitation Workers Learning Hub. So
Thank you. Thanks, Bisola. That was an excellent presentation and such a lot of detail. For me, it's just really heartening to see the representation of sanitation workers' rights within that agenda and the differences that you were able to identify by carrying out your methods like that. We're really privileged to have Eva Moya with us today to react to what we've just heard. Eva is Deputy Chair of the Pan-African Sanitation Actors, PASA, a continental body representing the private sector and organizations involved in fecal sludge management in African countries. And we heard Eva speaking yesterday in the plenary about the importance of involving workers in discussions around capacity. So I'm really interested to hear your remarks today. And thank you.
Thank you very much. Again, my name is Eva Moya. I do not have slides because I wanted to have a heart-to-heart talk in this conversation, and I didn't want you to have slides, so that you take away something that feels in your heart. So I'm happy to be here because Kanika, Abisola, we've been talking online, and probably most of you, but we've not been able to know each other one-on-one. We met during the UNC. And I stand here on behalf of the sanitation workers. Like I did say yesterday, that probably if you find me at work, you have some culture shock because you can't coordinate my face and me when I'm in my overall. So I authentically stand here as a sanitation worker, and having worked in this space probably for 28 years, and having employers, employing people who are working for us in this space. So the link of research brings in research and practice, brings in now the authentication of us to have a discussion of sanitation workers. And when we speak about their health, their safety, and their dignity, is looking at it from a research space. I always coordinate my talk with a story where we had issues in India. And how many deaths do we have out of sanitation workers? And when I talk about sanitation workers, I'm not just talking about manual emptiers. I'm talking about cross-board from men and women who handle sanitary waste, men and women who are employed in the airports. And you go into an airport, you all came here, you flew in here. If you didn't, you've already, I'm sure most of you have flown out, where you have a space at the airport, an entire airport. You have cleaners who sit inside the toilet waiting for you to come out and clean, and there is no a janitor room. So totally, it is research that informs the engineers and the architects to have a consideration of this person who sits at the airport to clean your shit, I would say that comfortably. And after cleaning, they just sit on top of a sink or stand when they see you, because they do not have a space that they can go into. And so this is now where you bring research that informs all the key people, the engineers, the doctors, the architects, on the matters of what it is that we need to have. I'm a woman, so I speak from a space of a woman, and I'm looking at a sanitation worker who is a woman. They are going through their menses. They are having menstrual pain. They have to go to work. There is no space around where they can probably retrieve back and try to consider what it is that they are going through. So when you're having this discussion and the reactions that I'm supposed to give in the implication of research and implementers, it's now where now the government will listen, where now policy informs gaps. We get clear gaps, that these are the gaps that we are facing. So as we address the health, safety, and dignity of sanitation workers, we are addressing from an informed quantified and qualified space of sanitation workers. So this research was a very exciting process for us. In the beginning, when it started, we were waiting because we had it coming. I said yesterday, if I didn't say, let me repeat it again, probably I didn't say. In our space, we have a PhD in Google. We Google everything. So we know what is happening in our space. So we had ILO, SNV, World Bank. This is coming. And so we waited to see how is it going to show up and how is it going to come. They reached out, they called us, and I'm glad they did that. We were waiting. If you are not going to call us, we could have completely come to reject and say, we don't know what these people are talking about, but they did involve us. And even when they involved us, we trickled down. I remember when she called, I said, if you want to know about manual emptier, please let me give you Ali Dubande, who is a manual emptier. Let me give you a female manual emptier in Uganda, who is a manual emptier. Let me give you a sanitary pad collector, the person in that space, because we have them, they're in our associations. So the integration of the research and us brings in the practicality and now the theory behind designs and planning that we are looking for, and that have been missing in the gap. So I am a clear advocate of the meeting that is happening in New York next year in March. I've asked this question and I'm asking again. You mentioned about it and you're coming to respond to some of the reactions that we have here. In looking at research, I like the meeting. The name of the meeting goes high level. But we have 2.8 billion people, according to research, that in 2030, they will not be having access to safe sanitation, safely managed sanitation. So I'm looking at high level and I'm looking at the word high level and I'm looking at the word 2.8 billion. And I'm looking at the people who work in the space of the 2.8 billion. So where will be their voice in the high level meeting? We are high level at the space that we are in because we make things happen at that space. We are the ones speaking. So it is interesting to find in the high level meeting, people speaking on behalf of 2.8 billion people, that they really do not know exactly what is happening in the 2.8 billion. And again, probably the number is not even 2.8 billion. Probably the numbers have reduced. So they have reduced. Why? Because as we do not have mechanisms of reporting to the SDGs. I remember during COVID, we had, like, for example, my company, we did low-cost small biodigester septic systems. People were home, so all the toilets had issues because everybody's at home, so people eat and just toilet, people eat and toilet. So we kind of were running, it is the sanitation workers and the doctors that were busy everywhere during COVID. And we did about 32 biodigester septic systems. And that is the time it dawned on me, who do I report to? Supposing I am building wrong septic systems, who is monitoring? Where am I reporting? I'm 32 and probably it's coming to a number of having safely managed wastewater to 200 persons, but I do not have anyone who monitors. I do not have any place that I report to, and I could see clear policy gaps, and I could now see different activities happening. The same time, it took thinking during COVID that I reached out to the health personnel that I know, and the waterborne diseases had reduced drastically because of hand cleaning. And so we were totally looking at different spaces and looking at different innovations coming on board. We got a lot of contracts to build hand washing systems from different NGOs. And there was just this taking hand washing. And in some communities, like if you are here and you've worked in Western Kenya, they do not clean their hands just like this. It's taboo and culture does not allow. So they have to put their hand inside and clean. So there were all these things, that dramatic events that were happening. And the question was, who is informing these culture issues, taboo issues, who is informing these gaps that are within the spaces of engineering, in the spaces of architects, and even in capacity building, who is informing, and where can we put, where is the platform for us to give that information? So the formation of the Pan-Africa Sanitation Actors was different players in the private sector that were looking into addressing these gaps and addressing these situations. And as I conclude, our biggest challenge was, how can we quantify what it is that we are saying? Who can believe us? And the bringing in of research, and when SNV, when WaterAid, when World Bank, when international labor organizations sat down to start thinking about this, we were like, yes, now we are going to merge research and practicality, and we are going to have very powerful progress. And even in 2030, I can promise the SDG indicators will change drastically, because we'll now have platforms where we can inform in the next 8 years, and we will see the numbers change and going upwards. Thank you very much. And like I said, I did not have slides, but I do believe when you go to the airport or when you are leaving this building at UNC, please find out where the janitor room is, where they can rest. Thank you.
Thank you, Eva. Incredibly rich remarks and very powerful arguments for this collaboration, which seems to be a perfect example of how to ensure that voices are shaping the agenda as they should be. I think for that reason, it's useful to stop now. We've got 5 minutes just for questions. Eva, I would ask, if you don't mind, if you could come and sit up here in case people have questions for you as well. We'll have an opportunity at the end of the session for broader discussion. So if you could save your remarks till then. The 5 minutes we have now are really for any questions that you have, points of clarification to Abizola about the research agenda, or any reactions or follow-up questions that you have for Eva. We will keep it to 5 minutes so we have a chance to hear from our other speakers as well. Over to you. Don't be shy. Bruce.
Well, I'm not shy. Thanks both for the great presentations. And I think there's a lot we could talk about. Trying to hear voices and actually making those links with the quote high level. But I just had one question for Abizola, and that was, you mentioned, so there's a research agenda, and there was, I guess, if I'm getting this right, from the perspective of the sanitation workers themselves and the purported experts.
Yes.
I just wondered if you wanted to tell us a little bit, just sort of from the heart, what you thought were the differences and maybe why, or just any kind of feelings you have about having those two separate lists and what came out, what struck you.
Okay, thank you so much. So I would say that many of the things that the sanitation experts really focused on is in improving the implementation approaches already existing. And so there are quite similarities between both two. I can mention some of the similarities, like sort of improving the design and use of PPEs and making sure that there's capacity building to ensure that sanitation workers unions are part of the table. But the thing for the experts is that we focus a lot more on the research aspects, such as how do we ensure that allied stakeholders, local, national, governments, private sector, all those high-level stuff. I think that's what the experts more focused on, while the sanitation worker focused on issues affecting their health in terms of their the risk of the job, the hazards of the job, as marginalized workers, the kind of social stigma of the job, ensuring that there's behavior change at the user level so that their work is reduced. And for example, one of the priorities that struck me is when someone said, oh, can we sort of do a behavior change so that users can stop putting sharp objects and disposing sharp objects in the toilet, so that when we are evacuating, these things don't cause health risks for us. So there are kind of things like really focusing on those stigma, health issues, behavior change, local supply markets, improving this capacity of local supply markets. And one core thing the sanitation workers also really talked about is making sure that the success stories are captured and disseminated. And that really ties back to what Eva was saying, like ensuring many things are happening in the fields, but they are sort of fragmented. How do we put all these success stories together and ensure that sanitation workers are represented in implementation and decision-making at global and national levels? Thank you.
Thank you.
Any other question?
It's all crystal clear.
There's one from the Zoom chat.
Keep your voices up because as we have virtual joiners as well.
So what's interesting is that on the expert one, there's a question about formalizing the informal and the implications thereof for the visibility of the workforce, and then the logic being it would, once they're formalized, that could lead to reporting and support maybe and regulation, all these things you mentioned. When you were working, realized you didn't have. Is this an issue that from your point of view is also something that would help, would be a good thing to focus on? And for me, formalizing the informal goes much beyond research. Like this is the research agenda, so it's good it's on it. But it's much more about action that could be undertaken in other fields right now as well. We could be working on trying to formalize the informal, in parallel and doing more research about it. So what's your view on that?
Yes, it should be looked into, and if we have a space that we could report to, it's a policy and a governance issue, like put together. But that is why you're able to consolidate and find the human resource under that space, because without that, you can't even tell the human resource that what is doing what, where, how. And we've been calling for different countries. We're in 22 countries currently. And in all the 22 countries, what we find very interesting, you find 18 countries have the same policy gaps, have the same issues happening to them. So I think about what it is that I was doing. I know about 200 companies that do the same thing that I do back in Kenya. So I was now looking at probably 30, or you could reduce it to 10 by the 200 companies that I know. So if we are doing 2,000 septic systems and nobody really knows where we are doing and how we are doing it, and the technology we have, we either reuse the water or we soak away. So supposing we are soaking away fecal sludge directly. So what are we doing to the contamination of the underground water? So when we have these formalizations and when we have proper structures within government that are bent on policy, then we are solving like 10 problems with one situation. So that is now what we are looking at calling at, so that when we have an outbreak of cholera in Kenya, it sometimes takes us aback because we quickly, different organization, government puts a lot of money to resolve the issue of cholera, but we do not go to the roots. Why are we having feces in water? So if we address why we are having feces in water, it now completely addresses the root cause and we are able to save a lot of money. In the country that I come from, it was through research found out that in Kenya, we lose 457 million. That is about $400,000 per year because of matters of poor sanitation. That is a lot of money. And still, even now, nobody seems to be getting into the space, but it's because when you dig deep and ask even government officials, they say there's a lot of confusion, you don't know where to start. Mm-hmm. So now we come as now the private sector, if we regulate ourselves in our own by forming different associations from the community level, then we are going to bring sobriety into the space and we're going to say we are here. And we can talk to you, we can tell you what's happening on the ground. You can also use us for policing the different things that are happening at the ground level. I hope I've answered the question.
Thank you, Eva. I have to say, I could hear you listen to you talk all day about these things, and so interesting. I think we can take one more question from the floor if it's quick, and then we'll move on to a few further.
I'm not sure if it's quick, but right. Hi, I'm Kavita. We had another loudly. Okay, hi, I'm Kavita from India. We actually had another side session on safety because we're working on the ground. And what is important, what we are finding on the ground, having moved ahead a bit, and that's, is you mentioned tools and technologies on both sides, but one of the key things is where's the money for that going to come from? I'm sorry to bring up something as banal as this, but you know, and I'm not saying it shouldn't be prioritized, giving all the investments going, but the workers clearly are not able to do it. And if they're private workers, the governments are not ready to invest in it. And the demand from the workers we are working with is that somebody provides them with those tools and technologies. And if they're manual employers or equivalent, then you know, to move to semi-mechanized form, right? I don't know if that came up in your research at all. And the second good thing is, from the sanitation workers perspective, did anything around intergenerational equity came up? Because one of the things we're hearing again and again is that we don't want our children to get into jobs. Just a quick reflection.
Thank you so much. That question on intergenerational effects, yes, came up like 3 questions on what is the intersectionality between poverty, lack of opportunity, especially in the case of India. We saw issues like caste and how that affects the work. And also, how does the issue of some of those stigmatization affect negative coping mechanisms, such as emptying at night and all those practices that workers do. We saw some of those issues. It's just not part of the top 10, but they are definitely there. And the issue of funding you mentioned, the experts really talked about that too, about like ensuring that there's research investment. The multilateral organizations are working to ensure that there's, how do we strengthen partnerships? How do we ensure that the allied stakeholders are working together? And how do we ensure that we are not duplicating efforts across board and we're coming together to sort of invest efforts and invest money and time in this field. But many of, I think the sanitation workers sort of recognize that even though the issue of the money is important for the research, but they are more focused on what is really important.
Sorry, I didn't mean money for research. I meant money and buy the actual tools.
Okay.
Because the workers don't have that money. And so.
Sure. Okay. Yes. So the issue of the money for the tools, it's more like, I would say it's more like capacity building and making sure that locally adapted solutions are available in terms of like, how can we adapt the local technologies that are available and open the markets, the local markets, the local supply chain markets. But I would say that the funding part wasn't really focused on as much.
Thanks, Bisola. And I think probably we'll come back to that when we have Mary talking about sort of the importance of this research agenda for advocacy efforts and potentially then enabling increased financing for these critical pieces. So we've talked a lot about how important this research agenda is and the key gaps that you've identified. We're going to turn now to Dr. Tanvir Ahmed, who's a professor in the Department of Civil Engineering at Bangladesh University of Engineering and Technology, and the director of ITN Buet, which aims to build capacity of WASH professionals in the country. To hear about, so we've got all of these questions, and so what are some of the answers, and to hear about the specific research project that is the winner of the award this year. Over to you.
Thank you. Thank you.
Sorry, these are not your slides. Sorry, you're having a sneak peek of the next presentation. Here we go.
Okay. Thank you very much. It's very nice to be here. And first of all, I'd like to thank UNC Water and Health Institute and WaterAid for nominating this abstract as the best research abstract award for the best research abstract award. And I think it's an honor for us and will provide us further impetus to carry out these type of studies in future. So what I'm going to talk about specifically is barriers to using PPEs by waste and sanitation workers. And I'm going to talk from our experience in some of the Bangladeshi cities. But I shall also touch broadly on other aspects of waste and sanitation workers regarding health and safety and other issues. So, of course, we are talking about sanitation, waste and sanitation workers in the context of Bangladesh. So it's not only the septic tank and pit emptiers, also talking about the drain cleaners, the garbage collectors, road sweepers, and also the medical waste handlers. So whenever we talk about waste and sanitation workers in the context of Bangladesh, these 5 categories come into mind. So, but what they have in common is they are all part of the informal economy, and they have different PPE requirements respective regarding their jobs and regarding their job. And there's also a huge range of activities. For example, in this case, if we look at workers in the sanitation value chain, starting from toilet containment to end use, there are different levels of activities that they're engaged in. And also in other categories of works and other categories of workers, their activities can also be disaggregated into all these different bits and pieces where different types of risks are involved. Some of the key challenges which are known to, I think, almost all of us is the first thing that comes to the mind is occupational health and safety, because we know that they are exposed to multiple hazards. They lack the knowledge, and also where the work environment is not conducive, and the municipality where they work under, they do not have the capacity to train them or provide the PPEs. There is weak legal protection, and we are talking about, I think, for a long time, and they're not part of an agency, so they cannot demand rights, etc. There's financial insecurity because their work is kind of temporary and informal in nature. There is social stigma and discrimination, and all of these are contributing to this type of situation. This is a comparison between their working condition and where they live. As you can see, even if the working condition is hazardous, their living condition is not good either. Where they live in congested areas, low-income communities, lacking basic services. So it's all the same whether they go back home or where they come to work. But this pandemic has kind of brought this issue of waste and sanitation workers to the forefront, and I think, it's because of this COVID pandemic, they are now facing a higher kind of risk. And as we've seen in Bangladesh, during the pandemic, they had to work additional hours with no additional remuneration, and there was no reprieve from work. We can all sit back and work from home, but they cannot work from home, of course. The PPEs are, of course, a concern, and they move across different areas. So it's not that they have to collect waste from this area to that area, and they can be the agents of transmission of this pandemic. So there is definitely what we agree that they are at a higher risk compared to us general population. So that prompted this study where we looked at their conditions in 7 Bangladeshi cities. We looked at these worker groups, and we also interviewed all these different local government officials, the municipalities where they work in, and we tried to get some information like what the situation is like through the 2 methods. So the assessment was done partly qualitative and partly quantitative. The quantitative part was based on surveys, structured observations, where we collected data on the type of work they do and the hazards they face. But the qualitative information, which was based on key informant interviews or in-depth interviews, and that part was also in this total study. The quantitative study, which we just published here, and it basically addressed how the knowledge, attitude, and practice is contributing to what type of hazardous environment. We tried to connect all the factors to their work environment and their safety aspects. We also looked at how the socioeconomic conditions, stigmatization, etc., affect the nature of the work. But what we are going to talk about today is the part of the qualitative study, which is based on these interviews and we did with the local government officials and also the sanitation workers. One thing came up because we are talking about PPEs. PPE is very critical with respect to job satisfaction, social acceptance, and dignity. It appears that when we interviewed them, they thought that the PPEs actually gave them some sort of identity or dignity. You're working in an environment, and if you have a vest which is colored, and maybe it has a seal of the municipality, and people kind of regard their job a little bit, they look at them a little bit differently. They act with them differently. And it has been found from their interviews that they've been shown better respect if they have that thing on them. Also, it enhances social acceptance. It's also underlines their dignity. And some of the discriminations that they faced in the environment before kind of partly were attenuated because of they were wearing these clothes. And it was suggested that even if we provided training to them, if we provided these instructions, organize them and bring them together and show them how occupational health and safety things should be addressed, this also gives they feel that they are valued, their job is important and things like that. That also gives them a little bit of moral boost. But the thing is, when we also interviewed them, that several issues associated with PPEs came forward. And this is something that we need to discuss. So as we know, the PPEs that it has to be comfortable to wear because they're going to work in long environments, adverse environments. It has reflect heat, prevent sweating. But the PPEs that were provided to them before didn't actually were not that good. And they felt shortness of breath after wearing them, the masks and everything. Eventually they were not inclined to keep on wearing them and use them. There were issues associated with the gumboots that they received because the regular gumboots that were provided to them, they were not liked. They were probably after several uses, they got torn and everything. So the gumboots should be light, strong, durable, and proper sized. So if they found that the boots were heavy and it was difficult for them to wear, and they were not inclined to work in a septic tank with those boots. Hand gloves should be thick, durable, sweat reducing, and usable multiple times. So so they mentioned that it would be good if it was not damaged after washing. So they found that after several washes, because these things have to be washed several times, they did not fit their hands well, often they're very loose and something like that. The gender issue has come forward as well from the respondents because these PPEs are like generally made. And but in Bangladesh, the women workers, they wear saris and this type of clothing. So the PPEs that were handed to them were not fit for the task. And they mentioned that they cannot wear the boots with these clothes. It's altogether uncomfortable. And the boots provided to them, they were designed based on men's feet size, and the gloves were of men's hand size. So the physical anatomy and the body structure was not taken into consideration when these PPEs were designed. So those were actually important. So there is a need, and they also mentioned that these PPEs have to be more female friendly, and the female waste workers do a different type of job, and the male waste workers, they do a different type of job. And there is also a segregated job description there. There were other issues like one set of PPE is not enough. They mentioned that most of them work at night, so it gets wet. So then the next morning, if we want to look for that, didn't dry overnight. So they suggested that at least 2 sets of these should be provided to them. They also mentioned that regular trainings should happen. The training should not be a one-off capacity building initiative. There has to be regular refresher trainings. Things we know now will forget, that sort of, so some refresher activities should be done. And the local government officials mentioned that the monitoring activity has to be more regular by the municipality officials, that whether or not they're wearing PPEs, wearing them correctly, etc. Similar voices were heard in other studies as well. I'm mentioning here 2 in this case, done by WaterAid. They found in India that the apron they provided, it was made of plastic, and it became very hot when they wore it. In Nepal, they found that the apron was made of polythene. It got torn up, and the women, they didn't really feel good about wearing torn PPEs. So these issues were there. These are some also highlighted in our quantitative study. Most of them mentioned that suffocation and the PPE not fitting them is a problem. And previously, what happened is that they were just delivered PPEs, but they were not provided the training on how to properly use it. So that's something that has to be addressed here as well. So finally, want to summarize this as that the PPEs is not only protective equipment, it also provides the workers a sense of dignity, social acceptance, which we also need to take into consideration. The PPE should prioritize the user's perspective. It has to be available to them and comfortable. Training, monitoring are also important. Just before ending, I'd like to highlight one particular thing, because we are after, or probably at the end of the pandemic, and this pandemic has basically threatened the health and safety of all of us, but also the sanitation waste workers to a larger magnitude. And one of the reasons is that the poor sanitation systems in a country like Bangladesh, we have a poor fecal sludge management system. So, what happens is that we've seen a lot of studies where the SARS-CoV-2 sewage surveillance is being done, and it predicts when the community is going to spread. When SARS-CoV-2 is going to arrive. A lot of studies, but in Bangladesh, we found SARS-CoV-2 in the stormwater drains, and a lot of studies were recently coming out based on Bangladesh, where we have the SARS-CoV-2 genetic material in being conveyed in stormwater drains, which is supposed to convey rainwater, stormwater. Now, what this means is that our sanitation system is so poor, the untreated fecal sludge and everything is kind of being conveyed in the drains. Now, imagine a drain cleaner who is supposed to clean the drains. Now, he is exposed to all of these pathogens, which is directly or indirectly. It's not supposed to. But if the drain cleaners are working in this environment without any PPE, then that means he's exposed to pathogens, and the risk is multiple. The other factors are also contributing to their threatening their health and safety. One of them is that waste collection system in Bangladesh is unsegregated. The medical waste gets mixed up in domestic waste. And so that means infectious waste mixing up with regular domestic waste, and the domestic waste itself becomes infectious. So the people who are collecting domestic waste, unknowingly, they are also exposed to some of these. And we are disposing PPEs after use everywhere, not in a medical bin, but also in our regular bins. And all of these are contributing. So when the waste collector comes to collect that, without proper protection, that means he is also exposed to pathogens and the risk is heightened to some extent. So it's not only, finally, what I want to say is it's not only the PPE provision and the proper PPE design. There has to be, you have to use technology to reduce the effect of this manual cleaning, and we're talking a lot about different innovative tools to be used by the manual cleaners so that the risk is less. In addition to that, we have to think about the financial support and incentives to work in a heightened period like the pandemic. We know that many of them are working in a risky environment without any additional pay. Training and awareness, it has to be systematic. It cannot be a one-off thing. And very, very important is that you have to vaccinate the waste and sanitation workers, not only for COVID-19, there are other infectious diseases as well, and they have to be immunized. And there has to be rigorous monitoring. So this is kind of the last slide. So just to highlight this a bit more, 4 of the 17 SDGs are directly linked with the rights of sanitation workers. SDG 1, 3, ending poverty, ensure healthy lives, promote well-being, water sanitation for all, decent working conditions. So these are directly or indirectly linked with sanitation workers. I finally like to acknowledge, first of all, ICDRB colleagues who did all the hard work. I'm just presenting it. My colleagues at ITN Buet were instrumental in reviewing this initiative. We see some of the training manuals that we have developed. These are customized, contextualized training manuals in local language, which we use to train the waste sanitation workers in the Bangladeshi cities. And the other thing that we have here is the COVID-19 vaccination plan of Bangladesh. So ITN Buet, along with the FSM network, we advocated that the waste sanitation workers should be prioritized in the COVID-19 vaccination program. And that was a success, and the government kind of approved it. I'd like to also thank the DPHE-CY Citizen Support Cell and finally the PMGF for providing us support and the opportunity for this study. Thank you very much.
Thank you, Dr. Tanvir. And Dr. Tanvir will be receiving his award in the plenary session immediately following the break. So hopefully you can join us for that as well. And some really interesting insights from the study in Bangladesh. Thank you. And of course, research and evidence holds huge potential to inform decision-making. And I think this initiative has really set itself up very well for that, with a partnership between academic institutions, between grassroots organizations, and between advocacy organizations as well. So our final speaker, Mary James Gill, is a human rights lawyer and activist and the founder of Pakistan's first advocacy campaign for sanitation workers' rights. Sweepers are superheroes, and will give us some examples of just how that can happen and how the research generated can help inform real world problems. Sorry, I'm not very technologically savvy, so we just have to do it this way. Can you tell me?
Thank you very much. I'm really honored and humbled to be part of this prestigious gathering and this platform. I'd like to acknowledge Initiative for Sanitation Worker Support for me to be part of this side event and presenting Pakistan as a case study and how we have been able to some extent, successfully give visibility to sanitation workers, who we call superheroes. Some context of Pakistan, many people might not aware of Pakistan. I usually hear that, where is Pakistan? So I have to tell them it's right next to India. You're familiar with India. So Pakistan is located in South Asia. It's the fifth most populous country with 220 million people. It is the second largest Muslim population in the world, and it is composed of 5 provinces. Islam is the state religion, 96.47% population is Muslim, and there are some other small minority groups who belong to different religions, including Christian, Hindu, scheduled caste, Ahmadiyya, and others. Sanitation labor in Pakistan is institutionalized as well as done by individuals, but most of the time I'll be talking about only the workers who are employed by the municipalities and district authorities. Both have, their districts and municipalities, they are responsible by law to provide sanitation and collect waste. The number of workers in municipalities depends on the size and topology of the district. The situation of sanitation workers is highly deplorable. It's not different from what my brother Tanveer from Bangladesh was representing or what we heard from Africa and other developing countries. They face shame, stigma, and discrimination by the state and the society. It's very important. But most interestingly, even if the Christian minorities make up only 1.26% of the total population, but their representation in sanitation labor is 80 to 90%. It's very important because in Pakistan, religion is an important factor and is often seen a motivating factor for several aspects. And I'll hold you back here why this is the case. And I have the research study right here in my hand. It's shame and stigma in sanitation, but it's also, so the reason that the most appropriate person for this research or this representation would have been my colleague, Asif Akil, who is also the lead researcher, and all of our work is based on this research done by him. I only contributed my bit to turn it into a development agenda. And this campaign is based on this work. So how come they suffer shame and stigma and there is this notification, it's banning the word chura. Chura is a derivative word and you'll keep hearing it for the rest of the presentation. So it's important to see why out of the blue last year on December 10th, where, a district officer, he issued a notification that there will be a legal action against anyone who will be using this word, chura. And then here comes another tweet by a spokesperson of the Punjab government. He says that we need to start a campaign using respectful words for sanitation workers. It's only a year ago. And then we see a notification by the Punjab government on uplift of self-respect of sanitation workers across Pakistan by banning the word chura. It's interesting to see that how a word, a stigma that is centuries old, how this suddenly changed and the government started taking notice of it. And this all started with this one poster. It says, a sanitation worker says, I'm a sanitation worker and not a chura. And here comes another one saying, respect is my right. And comes another one, why am I still a chura in the 21st century? I'm not ashamed of my labor. I'm also a citizen of this country. Quality education and recreation is also my children's right. I'm a human being, not a trash can. I'm proud of my hard-earned money. I have been abused a lot. Now I want to be respected. Everyone wants cleanliness, but why do they hate cleaners? I'm a hard worker, not a beggar. If cleanliness is half faith, then why am I called dirty? It's important connotation because according to Islamic values, it is a hadith that cleanliness is half faith. So this question, these all questions put out by those sanitation workers, if this is the case, that why they're being called dirty. And this maybe give you a little bit more understanding what I'm talking about. So Pakistan, as I said, it's a Muslim majority country and Christians are in small minority population, but still their representation is very high. So high that Christian as a religion and chura, it's title of the traditional caste, and sanitation worker, they have become overlapping in colloquial language. So I'm a Christian, but I'm chura at the same time. I'm not a sanitation worker, But I'll be considered as sanitation worker just because I come from a Dalit scheduled caste background, from a special that is Chura. So this is another, other than this research, although we already had some job advertisements coming from public sector government organizations mentioning religion or caste repeatedly. So this is just a small analysis of job advertisements of 300 job advertisements clearly mentioning, most of the jobs clearly mentioning only Christian or Dalit Hindu or Muslim Sheikh. So no matter which religion you come from, as long as you come from the same caste, you'll be treated the same way. But Christian, in that case, they have become interchangeable, these words, 3 words. And namacy, this is also in the study, we have seen it as a case study, that how those children whose parents are sweepers, how they are being treated by the society and the state at large. So Nasimasi, he was he is son of a sweeper, but he got qualified and he applied for a clerical position in education department. But then the officer refused to appoint him as an office boy. Rather, he was given a notification of a sweeper. He went to the High Court, and it took him 6 long years to struggle to see that this is he qualifies to be an office boy, and he was forced to take the job of sanitation worker because his father was a sanitation worker in the same department. And this is not, so these are rare images you will see before this campaign started. And this is the latest job advertisement clearly saying that only Christians can apply for sweepers. And we can also see we have ample evidence to establish that state, society, and taskmasters who happen to be supervisors and come from Muslim majority, they make it happen that these workers only work in those sewers like that. But this is not the end of it. I mean, this is not all the gloomy picture we have. Due to this advocacy evidence, this research-based evidence, the evidence we provided to the government, and based on that, we did advocacy with the government. Recently, this year in May, the Punjab government issued a notification indicating that any advertisements indicating Christians against the post of sanitation workers are in violation of not just human rights, but they are also in clear violation of CERT, because Pakistan as a signatory of CERT cannot have any such practice or recruitment policy that clearly says that it's a discrimination based on work and descent. And this is how it started. This is the first photograph ever taken in Pakistan when we started this campaign back in 2017. It was also after the death of a sanitation worker. He was a sanitary supervisor. He was supervising a sewage blockage, and when 2 of his subordinates went down, I'm sorry, it's very difficult whenever I think about that incident. And when those both sanitation workers, they passed out, he went down to save them. And when he was taken to the hospital, the doctors refused to treat him, that this is because he's fasting, they must clean him before bringing him to him. And then a pharmacy died right at that stretcher. And after that incident, that was the first thing that I realized, that this is not just it. Those workers die every day and we don't even know. And most of us, including me, we did not know that they were cleaning those sewers manually. And then, but it was very difficult because online you would only find footages or images from India or Bangladesh, but no footage or image of any sanitation worker who goes down the sewer every day to clean our shit. And he's so invisible that even people don't know about them. So that was the prime focus of this campaign. And this is the cover photo of our sanitation hero as well, Shafiq Masih. He's our volunteer, and he was the first person who volunteered to be photographed because of the shame and stigma attached with this work. they did not want to be seen. But then now this year, this campaign has been adopted by the government institution of human rights to stop systemic discrimination against minorities. And it's not very different what he was saying. They live in hazardous conditions. They just don't work in hazardous conditions, but they live in hazardous conditions. So these are just two images to remind us that they are real humans. And through this research, the first thing we try to break the stigma of bringing them in public eye, to make people realize that they're real humans who are cleaning our shit every day. And they're not just being, they're being ignored for so long, but they're also being realized as someone who are sinful, who do not, they do not deserve any respect. They do not deserve any visibility in public eye. This is why, as long as the sun is up, they're gone. They clean everything and they're gone as soon as there's daylight. So this is just from me. I'll be happy to share more if there are any questions. Thank you very much for your kind patience.
Thank you, Mary. I'm afraid just for the time we've gone a bit over, we do have to leave it there, but there's a break now for half an hour. So I encourage you to discuss among yourselves. And if you have questions for the speakers, then please do approach them. Thank you so much.
I was looking forward to meeting. I honestly.
Unshare that. I'm just virtually because there were questions.
It's great to, I want to chat with you. They talk all the time. There's words that sound good, and then there's how does it actually play?
But I was. Yes.
Thank you so much.